Recording in progress.
All right, good morning. Welcome to the Thurston County Board of County Commissioners Board Work Session for Wednesday, January 14th, 2026. It's 9:03 a.m. My name is Ty Menser, Chair of the Board. To my left is Vice Chair Commissioner Wayne Fournier. And on our Zoom platform is Commissioner Carolina Mejia. Commissioners Klaus and Grant have other meetings conflicting, so they may come midway or not. The meeting is being live streamed to Thurston County YouTube channel, and written public comment may be received up to 2 hours in advance of the meeting and distributed to the board. Action may be taken at this meeting. First, we have a kind of miscellaneous set of topics this morning. First up is the Sheriff's Office, medical malpractice insurance for jail medical services.
Thank you so much. If we could have our risk manager, HR director, our sheriff, undersheriff, please come to the table. Thank you so much for joining us. 9:45, I have to go. Heidi, happy to have you come on up also.
Come on over, Chief. Corner, we have to work fast this morning. Yeah.
And is Chad here also? Chad, you want to come and I'll give you one of the cushy seats here since our
Smart man.
Our assistant county manager is in jury duty right now, Jennifer.
Is she really?
She is, yeah, doing some reconnaissance.
Like a secret shopper.
There you go. If only. So I'll go ahead and turn over to Brian. Can we have you take the lead on kind of framing it, and then of course the sheriff is here to share some of the details. Thank you so much.
Okay. Commissioners, the item here today is about a jail medical malpractice insurance limits. Back in '24, risk management advised to the sheriff's office that we raise the limits in the contract from $2 million each incident, $4 million aggregate, to a 3.5. I believe back in '24, the sheriff's office came to the board and said, if we do raise the limits from a 2.4 to a 3.5, that would entail the jail the healthcare delivery services, our medical provider, they would have to purchase additional insurance. I think it was in the tune of $108,000 that year. 111 that year. At that time in '24 and '25, we felt it was very prudent to take on that additional limits. And because the contract, I think, was already negotiated, we, Thurston County, paid for that additional insurance, being that the volatile situation in jail litigation has gone to a certain higher level. So we felt that that was a good risk to take, and that return on investment for that money was well worth it. It was the industry, general accepted guidelines to go to a 3.5, up from a 2.4 at that time. Now we're here at 2026. Jail Medical has gotten a new quote for 26 from the insurers. It has increased from 111 to 154.
157,809.
157,809. So that was not in the
table, Heidi.
The accountant in me. I also got budget in me too. That's 158,000 for budget.
So I got the general numbers. Heidi has the exact numbers. It's an additional 48,000.
46,495.
40, we'll say 47.
Yep.
$1,000 to the 26 budget that they had not planned. So risk is here because of what we feel the return on investment is worth. To talk about any kind of not really past claims as a whole, not talk about specific past claims. I guess if we do get into that, we would talk about that differently. But that's kind of the background of the whole situation. Do you have any questions for me specific, or do you want me to go a different way to lay that out?
And to be clear, what we are you're here to request board direction on, do they want us to go up to that new amount?
Exactly.
Yeah. And so that would require additional, I'm looking over at Summer, that would require additional general fund support, correct?
That is correct.
Okay.
Additional what support?
Oh, general fund support, you would pay for that, yeah.
So if I may, this contract is renewable year by year, and so we renewed it for 2026 at the 2 million, 4 million level, not the 3 and 5.
Partly because we didn't have board authority, so we didn't have the authority to go up. This is the earliest time that we had to come and have this conversation with the board.
Commissioner Mejia? Commissioner Mejia is here.
Thank you, Chair. Can you hear me?
Yes, we can now.
Yeah? Okay. Okay. I just, thank you, Chair. Maybe I'm just like, missing, but I do kind of want to hear like some examples of kind of the benefit that we've gotten, right, for that amount. Like what exactly is it covering? So I'm not sure if we're going into claims if it needs to be an executive session. But I just kind of, I need a little bit more is, I guess, what I'm asking.
I think I can take that. We don't need to go in executive session just to talk generalities, and some of the claims in the past are closed, so they're not really litigated that we need to go into executive session. We can talk about this openly. In the past, and as far back as I know, we have only used the jail medical's insurance limits on one specific claim. Most of the time, the county is being sued, and jail medical healthcare delivery has not been named. And sometimes they're not negligent in the litigation. If they do have negligence or they were brought in or named on the lawsuit, then we could ask for their limits. But we've only asked for their limits on one case that I know of, at least in the 3.5, 4 years I've been here, and in the past, going back as far back as I could see, we haven't actually cashed in on their limits. So we have limits for our county, as you know, that we pay for the insurance, and we require them to have insurance limits as well. We have not really just cashed in on them more than the one time that I could see. So it would have to be where jail medical is named on the lawsuit, we are named on the lawsuit, they have negligence, it's found that they have negligence, and then we are asking for their insurance limits to be brought to the table for any settlements or any jury verdicts that are awarded. Does that help, Commissioner?
So it sounds,
Yeah.
oh, sorry.
Go ahead, County Manager, and then I do have another question if the chair allows.
I wanted to say that it sounds like obviously the coverage is a good thing, but there haven't been a lot of instances where we've had to tap the limits at that high.
Correct.
And so you're bringing this forward because the same coverage is now increased in cost. And so it's a kind of a cost benefit analysis that the board, a business decision the board has to make of, do they want to go to that amount, or do we want to pay a little bit less and have a lower amount of, and obviously as staff, you don't want to make that decision in a vacuum without the board being aware.
Exactly.
So just like take a back step, so the provider has insurance, but to bring it in line with, you said that by us going up, it necessitated them having an extra layer. So we're paying for like an extra layer on top of what they bring to the table. I don't know if I've got any of that right.
Somewhat. And I think you have it mostly right. I just might need to clear it up.
Yeah.
The original contract was negotiated for a 2 million, 4 million limits. During that time, Risk came to the sheriff's office and said, you know, we're reviewing this contract. I think it had already gone through the RFP process. In reviewing this, we recommended that they ask for 3 million, 5 million limits after it had already been, I think, awarded to them. So they had done their, business workings and said, we can do the contract for X amount. Then we came to them with higher limits and they said, well, that wasn't in the original. So if you want higher limits, you need to pay for them. And we felt it was prudent at that time to pay for those higher limits just because of the volatility of litigation within jails in Washington.
what's the connection? I mean, why can't you just have, it's not allowed to have, the county's got 3.5, but the medical provider coming in has 2.4, that somehow doesn't work?
Well, we have our own limits that cover the county. It's just if any of our providers or any of our vendors, we require them to carry insurance as well so that we don't have to use our insurance.
Right.
If we're co-named in a lawsuit, co-defendants, well, then we want everybody coming to the table to have as high as limits as we possibly can. So if they're found 50% liable, we're found 50% liable on a $6 million settlement, we want them to have 3 million in coverage if they can bring 3 million and we bring 3 million.
And if they don't join several, like we
Bigger
get hit,
pockets.
we can get hit for their extra uncovered piece, or
Yep. They would just come to the table with, these are our limits, these are insurance limits, where we have larger limits, which is public knowledge. So.
And when you said you said 3.5 is like a industry guideline or something, is that, I mean, there's guidelines that like nobody follows, you know, or then there's no guidelines where it's like, no, that's like, we're way out of whack. Is with, you know, kind of what does that look like?
It's the recommended guidelines that we are moving to just because of the volatility of Washington and litigations of jails. So is it way out of whack? No. Is it a newer guideline? Yes. And that's where we came in 2024 and said, this is more the recommended guideline now. We should go with the 3.5.
So 3.5, we can do that ourselves. So it's really a matter of, in a case where both sides are named, we'd have 5, not 6.
We carry 10. We have a $10 million coverage for our liabilities. We would just want any vendor coming in or coming to the table with us to have as high limits as possible. I mean, if they said, we'll do 5.7, we said that'd be fantastic. Do we have to pay for that? No, okay, let's do it. So always you want as much insurance as you can. That's the obvious answer. But when we're looking at our 2026 budgets and, you know, a tighter year and looking at every dollar matters, we felt we should come to the board with a $47,000 increase over what we planned for, as well as do we feel that this is the best return on investment for the total budgeted amount is 157.
Yeah, so the decision point before the board is, do we pay for the extra insurance that Risk and the sheriff has upped with board approval, of course, or since the price has been raised, do we go to one tier down? And as Heidi mentioned, that's what we signed the agreement for based on the budget authority we had. So it's really a business decision for the board, which direction we go. I think hearing from Brian that there hasn't been a lot of need for that higher level insurance is an interesting component that feeds into the business decision. However, as Brian said, and he wouldn't be a good risk manager if he didn't bring this forward, that it's always good to have more insurance, because you never know what's around the next bend.
Commissioner Mejia, you had another question?
I was gonna ask in terms of budget process and, right, like, if we're going to authorize more authority, wouldn't this go during a budget amendment? Like,
Yes, Commissioner, you're correct. It would, because of the timing of the renewal, the conversation, and the fact that the team learned about the increase that wasn't expected. That's why we're bringing it before the board to see what your what direction you want to give.
If I may, so the kind of the process that lined this out, Commissioner, was that the contract came up for renewal after, basically right in the heart of your guys' budget decisions, right? So as things are coming down, you guys are having your final discussions about the budget. They came through and said, hey, listen, if you want to maintain your current level of coverage, it's going to be an extra $40,000 a year. Based on the budget cuts that have occurred throughout the county, we knew that we couldn't absorb that. So what we did in the interim, I did not want to sign an agreement with the insurance provider and say, yeah, we're going to cover this, and then not know what the board wanted to do. So we approached the county manager and asked, how would you like to proceed with this? And he essentially, we all agreed that for the time being that we would sign for the lower amount at the same level of cost, and then we would bring this back before you guys for a potential budget amendment. The one thing I think is important to provide context for is that this is just for medical malpractice in the jail. Most of our lawsuits that are gonna come through in the jail are not medical malpractice as the risk manager advised. When you think about lawsuits, it usually the nurse is there to assist and is there to, you know, advise that someone needs to get transported to the hospital or something like that. Most of the lawsuits, quite frankly, are gonna be people who overdose inside of our jail. That's the big concern, I think, in jails across the state right now. And I don't know is that the healthcare delivery services are gonna be the ones who are named in a lawsuit most of the time in those scenarios, because if anything, we're just calling them for assistance and they provide Narcan and the person can't be revived kind of thing. So I think it's important to understand that these lawsuits are gonna be far and few between, we hope, obviously. We hope that, you know, our healthcare delivery services isn't in here, you know, committing mass malpractice, and we don't have any evidence of that. We really like our nurses and our nursing system. So a couple years ago, the board funded 24/7 nursing medical inside the jail, which I think has made a vast improvement in the ability to have someone there who is trained 24 hours a day to provide those necessary medical services. So I think the board's taken a number of steps. The question just remains here is kind of like what Commissioner Mejia is getting at is it worth the $47,000 to maintain the current coverage on something that hasn't really been challenged very often over the last decade?
And will likely go up each year.
Yes.
You know, liability premiums are going up.
Commissioner Fournier?
We're not the ones practicing medicine. That's what like confused me. It's like we have a contractor that is doing, that would be, that it's their problem. Whether they're committing malpractice or not is not, that shouldn't be on us. So is this something that should be like renegotiated in a contract? If we want them to have better coverage, shouldn't it be their responsibility?
It's still in our jail.
Part of it is, it was negotiated, the contract, that they were paying 2 million, 4 million limits. We asked for the additional limit, so they're paying to their broker for 2 million, 4 million limits. We asked for 3.5. They went to their broker, the broker said, that'll be an additional 157 to do that per year.
So
So we're covering that later.
if I may give the history on this, okay, so we went out to RFP in 2022. So this contract is gonna be up in 2027. We'll have to go out to RFP again. 2 and 4 million insurance limits were sufficient at that time. Went out to RFP, went through the whole process. The current vendor was awarded the contract at 2 and 4. Later on, year later, 2 years later, I can't remember when it was approached to me saying, hey, we need these at 3 and 5. I went back to the vendor because we were renewing the contract at that time. And I said, you know, we need to have this at 3 and 5. She's like, well, I can't absorb that. And I said, well, what's the cost gonna be? So we went through the same process again. It was $111,000. We went and did a budget amendment. We got the approval. We bumped the insurance limits up to 3 and 5. This contract is renewed January 1 of every year until the obviously ends and an RFP needs to be done. I start my contract renewals usually in October. I'm a one-person show in finance for contracts. And so we did, I think the budget was submitted around the 1st of August. So there's a timing issue. We're renewing the contracts in October after the budget's been submitted. So at that point, you can't do anything. You have to wait to the next budget amendment to have the budget adjusted for that. So that's kind of where we are. You know, if we want it at 3 and 5, it's an additional 47,000. If we don't, it's not. We're giving back that 111,000 because we don't need that. Right now, it's sitting in our budget because we don't have the opportunity to give it back. So I think that's the question. Do you want it at 2 and 4 or 3 and 5?
Yep.
And that risk versus reward.
Yep. Does the board need more information? I didn't want to think about it.
Question from Commissioner Mejia.
Thank you. I just don't think we have, I know it's 45,000, but we, we don't have it. I mean,
Agreed.
um, and that's kind of where my concern is. And if it's something where um, there hasn't been, a history, I think we're paying in other insurances enough that I feel like maybe this one we don't pay for that premium this year. That's kind of where I'm at.
If the contract was up and we said, you wanna work with us, you wanna provide medical services in our jail, you have to carry 3.5. Would they laugh at that, or would they have to comply with that, or would they say, we don't wanna spend the money, it's not worth it? I mean, where would how'd that negotiation go?
They could refuse to sign the contract and then we don't have medical services.
There aren't a lot
We
of.
go to RFP and we find someone,
Or, you can also say, they can also say, that's totally fine, we'll carry 3.5, here's your new medical premium that you're gonna pay us for the contract.
passing.
They're just gonna absorb that into the new rate. So I'm on the same page as Commissioner Mejia personally. I think that the low frequency of lawsuits pertaining to medical malpractice in the jail, I don't think there's any evidence that our nurses are engaging in medical malpractice. I think they're a major benefit to the jail. I think they actually soften liability inside the facility by having that medical expertise 24 hours a day. My opinion would be, given the county's current budget scenario, that we keep our current coverage level at 2 and 4 million.
And I would say from the side, we would support that. Again, I appreciate Brian flagging this as our risk manager. We want to make sure that the policy body was aware so that there was no gaps in information.
All right, I'm good with that. Commissioner Fournier?
Sounds good.
All right, agreement on that, thank you.
Are we still here?
Um,
You don't have to go anywhere.
Is the surveillance ordinance up today?
Oh, no.
I thought it was on the work session today. It's not.
we talked about it yesterday.
Just to kind of get some.
Yeah, just to get it
more
started, we'll be
investigation into
engaging
it.
with you in detail.
All right, thank you.
Here, stick around.
It's comfortable.
We'll let Jennifer know.
All right, getting set up for item 3 on the morning's agenda, which is a budget update and grow back plan preliminary discussion, I think is the plan there. So I'm gonna turn it to the budget team and county manager.
Thanks so much, Chair. We have our budget and finance manager, Summer Miller, here. And I'm gonna turn over to her. I think before we jump into the presentation, maybe if you could just frame the conversation and what's taking place up to date.
Good morning. Summer Miller, Budget and Finance Manager in the Commissioner's Office. This is a follow-up to the budget activities from 2025. Our primary objective in this presentation is going to be twofold: to recap the extensive 25 budget reduction activities that were undertaken to address the projected structural deficit, and to solicit the board's feedback and direction regarding the timing and the methodology for proceeding with the potential redistribution of the expenditure authority contingent upon improved revenue performance. For a little bit of background, at the close of 2024, the general fund faced a projected structural deficit of 26%, or $36 million for fiscal year 2026. For the board's directive, budget staff provided frequent, transparent updates throughout 2025. During 2025, we had 29 scheduled engagements with the board regarding the budget process, and these sessions covered a range of critical considerations, including revenue options, expenditure containment, balancing the budget, and addressing similar fiscal challenges observed across other state and local jurisdictions. Additionally, we had several individual meetings that were scheduled to provide additional information, education on methodology, which was used in forecasting, and to answer any questions that the board members may have had. Following our board direction, Go ahead.
I'll let you finish.
Oh, okay. On September 17th, the comprehensive budget reduction exercise was initiated with all departments and offices, and although not all participated in the exercise, the board provided direction on the projections and the reductions. And we did have 6 subsequent meetings focused on meeting those reduction targets through a combination of expenditure cuts, reallocation of the one-time revenue sources, and discussion on imposition of potential new sales tax and expenditure shifts.
And board, one of the things we heard as we were going through the summer and early fall from some of the internal stakeholders was that there had been from their perspective, a pattern of the budget, the Commissioner's Budget Office, often overstating the negative impacts or forecasts of the budget to create what they folks said, a doom and gloom perspective, thereby requiring them to cut more than they needed to cut. And in those conversations, and this being Summer's first year, where she's completely responsible for the budget, and this being the first biennium budget that I've built here with Thurston County, we thought, oh, okay, well, if we're missing something, if the forecast is somehow, which we didn't believe it was, but if there is going to be a change in that forecast, if the property sales tax projections were going to come in stronger than we anticipated, then we, in several, I think maybe 2 or 3 different work sessions with the board, we said we would be prepared to have a grow back plan on how to redistribute those funds. Where we sit here in January 2026 is that the projections that were provided to the board are not draconian, they're not overstated. We see things, indicators, the state is actually predicting a worse forecast than they had originally thought back when we were looking with them and taking their numbers. And property tax is coming back much softer than we anticipated. So this conversation and this idea, this is us being true to our word and saying we wanted to do this. However, the dynamics haven't necessarily changed. We were hopeful that, hey, maybe because this is the first time we've done this, but Summer has built budgets in other organizations, both in the county and outside the county in her professional career. I've worked on budgets extensively, from being a department director all the way up to running other counties. So we felt pretty confident on those projections, but no one's perfect and anyone can miss something their first time through. We thought maybe something isn't going to pan out the way we thought. Unfortunately, where we are today is the forecast was very accurate in predicting where those revenue sources would be. So we are not anticipating additional revenue at this point. The only caveat I would say is that because the entire organization, as being led by our financial services through the auditor's office, is still working through some of the TC Connect dynamics, which has delayed the close of fiscal year 2024. And we also know that 2025 will also be delayed. There is some lack of detailed information that would be needed. I'll let you explain that a little bit, Summer.
Sure, yeah, when the fiscal years aren't closed in their entirety, then we're unable to base the beginning fund balance, right, on accurate finalized numbers, and the figures change. So as they are sorting through all of the year-end close activities for 2024, I have to continuously go back and revisit the financials in that particular year, month over month, to identify if there's been any adjustments made. And that will be ongoing until that fiscal year is closed. And I just heard yesterday from the internal auditor that that there's a hopeful outcome of closing fiscal year 2025 in the summer, if not early August, and that's also very late. So although we can forecast and project with a great deal of accuracy, it won't be 100% there for beginning fund balances.
So the punchline is, at this time, we don't see a significant amount of additional revenue available to the board to then plug back in. That's the point of this exercise. It was in response to some of our internal stakeholders saying, but what if we're cutting too much? What if these cuts being based on the projection are too deep and there's more revenue? How would we add that back? Our response was, then we'll bring back quickly to the board a conversation on how to grow that back. Hence, we coined the term grow back plan, but we're not seeing that at this moment. So while we have a presentation ready to go through, and I'll do a bit of a spoiler alert, the end of the presentation was to direct us to work with offices and departments on the impacts of the budget reductions so that if there's additional revenue, the board could have a thought-through process with detailed information from departments and offices. We got a lot of great information from departments during the budget process about their cuts. We need some information from offices and want to give everyone an opportunity to equally provide that same level of input. And so we've created a template that we would be ready to send out. I think two things. One, that it's so early in the budget year, we have to, I would say a recommendation would be to give a couple of quarters to see how those budget cuts are playing out. And then two, we're not anticipating the revenue projections as being off to the point where there's going to be a lot higher revenue for us to come to the board and say, we now can put money back into the budget. And I'll pause there.
Go ahead. I'm just thinking, like, I feel like it's everyone that's not in this room that needs this conversation. Just to be painfully honest, you know, whether it's other elected officials or other offices or, you know, the budget battle of 2025 was difficult. And as you all stated, the projections were, you know, like just not given the credence that they deserved. And, you know, and that, to me, that was frustrating. But, you know, I sat a whole day in the Washington State Association of Counties Legislative Steering Committee meeting the other day, and every single county was saying the same thing. So, you know, you all sticking to your guns, I thank you for that, because there was a lot of pressure from all over the place to
Tell people what they wanted to hear.
yeah, to just tell people what they wanted to hear. The difference between what the other counties were saying they needed, they were asking for like dashboards and budget information from all the counties so that they could go externally and, you know, do work with legislators to help fix these budget problems. And, you know, I was like, you know, and I'm sitting there thinking, like, we don't need that information to prove the need outside. You know, it was like, we need that information from all of you just to prove inside that, you know, we're not fabricating this, that we're not alone in this, that this is a systemic issue, and the budgets are bleak across the board. And, you know, we do need to, you know, take these cutback measures. So it was, I don't know, it was kind of interesting, but, you know, maybe people, you know, the other offices will watch this meeting later, but I feel like, I mean, I don't know that I need the PowerPoint. I'm with you guys on this. I don't think we have the information we need to even talk about a grow back anything yet. You know, we haven't even gone through a full quarter to do any kind of assessment on where our budget really truly is.
The other thing I would say is Thurston County had the added challenge of the economy turning the way it did in the midst of its needed and appropriate legacy system transition from its old systems to TC Connect. And that's why it is not, we're not here to point the finger or place any blame on why it's taking some offices and departments longer to get the work done. That is a process we are working through. It is normal for large organizations when they change their financial management accounting system to have these delays. We decided to do it all at once as an organization, as it had been planned for years and years in advance, and the organization was frustrated at the delays, so they implemented it. We're going to get through this. We're going to make progress in 2026. The board approved the Baker-Tilly contract. We are working to provide a lot of those resources over to our auditors team so that they can close out the year. And we appreciate the hard work that they are doing in this process. But what it means is, this is not a normal time. The tools that would be available to our budget staff, and I see Jennifer here as representative of the team and all the department staff, to be able to run reports, pull information, get that together, and take, minutes to do that. We know that it took in some cases weeks, and that staff worked evenings and weekends to pull information together so that we can know it's reliable and how to move it forward. I'm extremely proud of Summer, I have to say, for a couple of reasons. This being her first year, two, working at a handicap with not having a fully functioning system. And then three, her forecast having such accuracy, right? Forecast needs to get you in the ballpark. But when you're saying I'm gonna hit the ball into left field, into this part of the stadium, that level of accuracy is really important. And so that's promising. If we can do it with those dynamics, I'm looking forward to what we can do in future budget years. And the amount of, as Summer mentioned, the amount of meetings and interactions we had with elected offices and commissioners, and the amount of support they provided in new documentation, quite substantial. So that's where we're at. I think that what I would preview for the board is, as we look at the closing of the year, we will be able, for 2024, that'll help us narrow down and focus in. And there may be some variance that takes place in expenditures or fund balance calculations that we would immediately come to the board. And if there's any upside, we would be back to the board to say, hey, we discovered that this took place, and as we closed it out, here's the final number, and now we have some additional resources to apply. We're hopeful for that. At this point, the economy isn't necessarily showing that there's a lot of signs that we're headed in that direction.
One of the things discussed with the auditor in, I think, a private meeting, I want to say, in a public meeting too, was about there was like, and again, I know this is probably, there was a lot of pieces, but this is only one piece. But on that one piece, there was like a new sales tax passed in the last legislative session, and no one really knew what it was going to generate for counties, if anything. And I don't know how long it'll take before we'll have like an initial flush of understanding of what that sort. I mean, that's just one thing.
Yeah.
We previously said that like the Grove Act plan for Commissioner Grant, thanks for joining, but we were just saying how like nothing we know like today really shows, a better forecast for upcoming, but, so what do we really want to do with this idea of having Grove Act plan? County manager was suggesting we kind of send out it was like going to be kind of a form or survey of sorts to the offices and departments to say, hey, how have the cuts? Because I'm really interested in this, because one thing that we can do that's valuable is like, you hear a lot of bluster during the budget, no one wants to lose a dollar. But then when cuts have to be made and people have to implement them, then there's a reality that may be a little different than what you heard in the fall. Like, oh, maybe that one wasn't so impactful as I thought it would be. Oh, wow, that one I didn't expect would be impactful, and it's killing us. So, I mean, getting that kind of feedback, like once the dust settles, so to speak, on what we had to do last fall, can help us be more informed and smarter about how we would reapply additional funding if and when we ever get it. Sure. So I would be interested in that exercise and getting that feedback from our elected officials, and then at the same time tracking, obviously, revenue resources. And that sales tax being one example of that was a big unknown. We went to WASAC, they were like, don't plug anything into your budget. We have no idea what this is or what it's gonna do. So that's definitely something on my mind I'd like to see. Maybe it means, money that we weren't able to count on for the budget, but it's gonna be there, and it's something, real. So those are things. So all of that said, the timing of this might need to push. You said a couple quarters, maybe a quarter at least, I think, for us to be able to have meaningful impact from the different elected officials that have to see what their budgets, what their operations look like without the money that they didn't get or whatever.
And Chair, our plan is, this is our touch point here in January, but to at least come once a month to talk to the board about the revenues the forecast, where things are at. As a reminder, when we built the 26-27, 27 still had a sizable deficit in it. That before we do anything, we're already starting there. Some of the one-time decisions the board made added to that deficit. And so our desire is to come to the board and to talk about where the projection, what does it do to that deficit? Does it open it? Does it close it? And if there are additional revenues, how does that close it in? It would be the best case scenario that the economy rallies, that some of these revenue sources do come in stronger, and it closes what started out as about a $20 million gap. It closes that up so that we don't have to make tough choices sitting
I don't
here.
think that's gonna happen.
I agree that it at this point, the charts and the trajectory of those, of that forecast isn't headed in that direction. And so we would want to be talking to the board at least once a month about the forecast and about the revenue numbers as it builds up to the 27 conversation.
I mean, you could basically go, every Boston department, exactly what percentage of their general fund budget got cut, and then to whatever extent there's additional revenue beyond projected, you know, dole it back out at that exact percentage. I mean, that's a simple and kind of, just to be kind of, you know, oblique, like a lazy way, people would say. We've been accused, or boards have been accused of that kind of approach. Anytime you try to be smarter and more targeted and more, and you know, you open yourself up to criticism, but I think it's worth that, and I think it does make sense to think about the impacts of cuts, and you know, it's our job really to allocate resources and not just follow some formula, not just having a formula and say, okay, well, that's what we're doing. So having all this would be groundwork for that type of a thought process.
Yeah, we're happy to come back, Chair, if that's the desire of the board, and maybe hold this until we finish the first quarter of the year, and have this conversation towards the end of March, early April.
Good luck, Commissioner Fournier. This legislative testimony to give. Commissioner Grant.
I'm guessing I missed the whole thing, right? You guys did the Pro-Back plan presentation already?
No, actually not. This was just preliminary comments.
Oh, okay.
And
Okay, well, I'll wait till after.
Summer did kind of this first slide, but you want to just kind of go through what you have since you haven't prepared it, and then we can.
Sure. Okay,
We still have a quorum here to proceed.
okay. Can we move that down? And we don't have to do the glasses thing. Okay, so in the fall of 2024, the board formally acknowledged that Thurston County was facing a structural deficit. Throughout 2025, the Board of County Commissioners devoted extensive time and multiple work sessions, 29 to be exact, to addressing the approximately $36 million budget shortfall. Our key actions included implementing budget containment strategies, evaluating potential revenue options, developing a balanced budget framework, inviting departments and elected offices to present potential impacts on service delivery, considering targeted restoration efforts where appropriate. In addition, bless you, the board committed to initiating development of a long-term grow-back plan to support the county's financial sustainability moving forward. The purpose of the Thurston County General Fund Grow Back Plan is to establish a structured policy framework and budget guideline that supports fiscal recovery, targeted fiscal restoration, and sustainable long-term growth for Thurston County. The rationale behind that is revenue growth continues to be limited by state-imposed levy restrictions, sales tax performance remains below projected levels, inflationary pressures and increasing service demands continue to rise, and deferred maintenance needs are accumulating and becoming more costly over time. The 2026 estimated base general fund budget of $160.8 million was developed using a combination of known assumptions, historical growth trends, as well as a placeholder amount informed by board discussions held in executive sessions. The estimate serves solely as an analytical tool to help the board understand the magnitude and the drivers of the county's structural deficit. The projected deficit for 2026 was estimated at approximately 36 million, and that was driven by anticipated expenditure increases and constrained revenue growth. The board prioritized budget containment strategies to slow expenditure growth, evaluation of restoration options to identify essential services requiring targeted reinvestment, long-term planning efforts, including the development of the Grow Back Plan to address structural imbalance and support sustainable fiscal recovery. This slide depicts what the estimated general fund base budgets were at the beginning of the reduction exercise. I believe that was in September. You can see that this is how we estimated to the 160.8 million. This particular slide showed the final general fund reduction target amounts after the board's activities over 6 different work sessions to reduce the reduction or restore funding back to offices to lessen the impact of reduction.
Yeah, and just to stress that the work the board did was substantial. And the amount of meetings and information that they worked through, kudos to the board for squarely addressing the structural deficit.
I also want to highlight the fact that all of this information was provided previously in the spreadsheets showing the incremental restoration efforts.
Many spreadsheets.
Yes, many spreadsheets. Okay, so the final reduction target by percentage is listed from highest percentage of department or office down to the lowest percentage or no percentage of reduction. And
Yeah, well, obviously, we couldn't take any action.
So
I think
just go
the
through the
information
information.
can still be
Okay.
presented.
Sounds good.
okay, so as we just discussed at the start of the presentation, the next steps would be to meet with departments and offices to analyze the impacts to services and programs due to budget reductions and create a list for board review. It's recommended by staff that we continue to monitor revenue performance, revenue realized, and to provide the board with updates on the forecast model as well as those the revenues that are realized, and that the board not take steps at this time so that we can get a few months under our belts in 2026. With that, we are happy to answer any questions. If there are any other.
Okay, so just to restate succinctly, the suggestion is to restate what the proposal is, County Manager.
Yeah, I think since starting the year, we're not finding that our projections are wildly off and that there's a significant amount of resources. There actually aren't any resources right now to be applied. Let's give this at least 1 quarter, and then we will come back at the end of March, beginning of April, and we'll have a whole quarter under our belt. And then at that point, we can engage, if it's the board's desire, with departments and offices on how the first quarter of the reductions are impacting them. We'll send out a template, gather that information, and then we can work with office and departments to come and present to the board on those impacts, which will help inform as we go through, if there are additional revenues, how do we apply those? The caveat is to remember that we are still looking at a 27 deficit, and it started at the 20 million. The one-time decisions have increased that. I don't want to say for certain what that number is because we're still working all those details through, but it is in excess of 20 million at this point.
Can you restate that in form of a motion so it can be clear for
Oh,
the
yeah.
record?
Can we put the presentation back up? Sure. I'll just add to that. Thank you. So it would be to direct the county manager to come back to the board at the end of the first quarter to discuss next steps about the Grow Back Plan. discussion of the next steps of the Grow Back Plan would be what's up on the screen. But I believe it's premature to do that at this time.
Would you like a motion, Chair?
Sure.
Okay, so I would move to direct the county manager to come in at the end of the next quarter to discuss the Grow Back Plan.
A second, sorry.
Discussion on this motion? Okay, call for the vote. All in favor, say aye.
Aye.
Aye, motion carries.
Thanks.
Okay, next up is commissioner reports on committees.
Well, I just,
Oh, yeah,
you
sorry.
can decide if you wanna put this at the end, but I was gonna, bring up a commissioner item, but it's related to this, to the budget. So I don't know if we could just talk about it now. Cause, so I appreciate, this was really great work. I reviewed all of it before we came down and, you know, I really appreciate it all. And I just wanna mention to my other commissioners that, you know, I sent, Leonard a message this week, regarding kind of a report, and I'm gonna actually show it to you guys. But you know, for me, it has been difficult for me to analyze and to figure out how we can put money back in the Grow Back Plan if I don't have a physical report. You guys have heard me say this, you know, it's just kind of how I operate. And so I just wanted to see if, and I'll talk through it really quick with you guys, but an example of other budgets, reports that I've approved this year as in different things, like this is the Thurston Mason BHO budget that they have us approve each month. You know, it has revenues, expenditures, and fund balance. And then this is the Pac Mountain Board of Directors budget that we approved as a Board of Director, expenditures, revenues, fund balance. That's what all the reports look like that are at the end of the budget cycle. And what I would like is a motion today to direct the county manager to work on preparing a report similar to these with these examples. I've put together an example. This is just a really basic example of what it would look like for us. And it is absolutely not at all fleshed out. It just was a bunch of things in a row. Just a basic example of a report that we could have for us that would accompany the work that you guys are talking about, because I was exactly thinking it would come at the quarter as well. That it would just be a quarterly report that's produced that shows us. And the reason I wanted to just show it like this to you guys, because I'm visual. And so it's like expenditures, and then you go down about halfway through this report, and then there's revenues, you know, and that, you know, if we have these columns over to the right that say, you know, here was what the original projection was, here's what it was the years before, you know, and then when we get to the end of the quarter, and it could be amendment or quarter or whatever you guys want to do, but you know, that they would say that these guys would come back and say, yeah, we're projecting that, you know, sales tax is going to be a little higher than we thought, and it would just be concrete numbers. And so that we can see where, you know, where we might be able to plug some Grow Back money in. And it doesn't have to be this exact same, this thing. It's just kind of wanted to show as an example in order to try to get some support here that we, So my motion would be to direct the county manager to put together a report that will be produced to us quarterly, that will have detailed expenditures, revenue, and fund balance for the commissioners to review. And I'm wondering if I can.
Can you repeat that?
Yeah. Motion to direct the county manager to produce a report quarterly with detailed expenditures, detailed revenue, detailed fund balance, and projections.
Can I ask a clarification?
Sure.
When you're talking about detailed, what is exactly that?
Like this. You know, or
So
like this.
just the like, because all I'm hearing,
You know,
seeing
so
here is expenditure, like,
expenditure detailed by, okay, you say by office and by fund.
okay.
Yeah,
By office and by fund would be easiest.
if I could add, Commissioner Grant, the
Yeah.
email you sent was a Thurston County
This right here.
regional planning
Yeah, or BHO, yeah, it was this one.
I didn't get the BHO one.
Oh.
You sent me the,
TRPC.
Oh, yeah, so that's just another example.
right,
Yeah.
but the TRPC was their $6 million budget high-level overview,
Mhm.
which in my conversation with Summer, that information we already produce in our budget documents.
Some of it is at a high level because the document that you shared with us shows like every position within that organization, and I don't recall exactly offhand, but I want to say it was like 19 positions on a $6 million budget.
Just an example.
Yeah, so like for us in our current budget book, we list, we have listed the total FTE count. The system has had some issues in the way it's designed, so we were unable to produce total counts, and I advised the board of that at the end of last year.
I think the point is, we're not sure from what you sent us from TRPC, like what you're looking for. And I have not had a chance to look at this information.
Sure, and I guess I am not saying that it necessarily has to be, I mean, for example, like this is the BHO one and it's, $38 million. I mean, there are just these kind of roll-up reports that I was just trying to say, I would like a roll-up report, and and I'd be happy if the board is okay to work with you guys, and I think that's what you had said in the message, is that you're happy to work with me to talk about what that might look like, and so I just want to make sure the board's in support of me working with the county manager. It doesn't have to be,
But in your motion,
in detail.
you're specifying a product that I think first we need to sit with you and find out what you need, because again, the information you sent us from TRPC, I couldn't ascertain what exactly you were looking for that's not already in our budget documents.
So we put this on for a commissioner's item or like an action item on Tuesday.
Sure.
And then that way
We can work together.
you can meet up and then see, and then we can have like
Tighter motion.
a tighter motion and then,
That'd be fine.
Yeah, because I'm in light of the, I just want to make sure that we are not creating additional work for our budget team that did see a reduction in the budget. That isn't going to be something that is valued by the entire board, and that, so
Well,
it
I
would be
mean,
great.
Like, there's the auditors, we get the monthly, in terms of, not the projection, obviously.
I know, it's
'cause they don't do
monthly,
that, but
it's very similar.
it tracks, and it sounds like what you're talking about.
That's exactly what right, it's
So we
just
have
one,
those.
just like one of those, but it will have a projection at the end of, each quarter, so it's a budget
quarterly
projection.
updates to projection that, I mean,
That
I
gives
guess
us
I'm looking
detailed
at this-
projections for each of the different buckets.
I would guess that something like that is,
We have something like that, and I'll just remind the board that I have sent that out to the entirety of the board previously, and it wasn't something I think that met what you were looking for. It is exactly a general fund projection, and it's at a high level, showing revenues and expenditures by those high-level object breakdowns. And then there was a detailed general fund status report that breaks it down by departments, showing month over month actual activity. I've shared that a handful of times, and that was not received. So I would agree with the county manager that to some degree, I would like to know what it is exactly we can do to improve the documents that I've sent previously, because it does seem like this is a duplication of work and our team is very small. And there's a lot of responsibilities on our plate beyond just creating the forecast in different variations.
I would personally want you guys to sit down with the documents that you have and have Commissioner Grant explain, okay, this is exactly this is what I need, and this is what additional I need, and then you can report back to us. Okay, in order to conform what I do now to what she's asking would be this amount of effort, then I can assess that.
Yep, we're happy to do that.
Yeah, and that way, I'm just trying to get us to a point where when we get to budget amendments, where I'm feeling completely comfortable and on page with everyone else to vote yes on things, and so just, I feel like we could get on top of it pretty quickly, and I'm more than happy to work with whatever data you already have and to just talk about how it might be moved around so that
Yeah,
we can
manipulate,
use
supplement.
it
yeah.
as a
I
whole.
feel like it's gotta be there, it's just a matter
Yeah,
of
it
maybe
is.
presentation, and we can
So then do we need direction, right? Because, yeah,
come
I mean,
back next
yeah,
week?
next,
Let's have a direction to have this as an item next week to
Next week,
discussion
yeah.
after there has been a discussion with Commissioner Grant
Sure.
and staff.
More information on that.
I think we need it.
I've already offered that in the email, and Commissioner Grant said she'd be setting up a meeting with her executive aide, so.
Throw that on the
And
agenda.
then, so, clerk, are we good for next Tuesday for this agenda item? Okay, perfect.
All right, then let's go to our last item on the scheduled agenda, which is reports on committees. I'd be curious how Board of Health went yesterday, since I wasn't there.
Yeah, me too, and then I do have something on transportation policy.
Okay,
With Board of Health, it went fairly well. We went over proclamations, and then we appointed a member to the Noxious Weed Board. We only got through April. We all failed in our homework to send in our proclamation. Every single one of us, so I was guilty of it too. And so we kind of went back to like trying to figure it out. So I think we got through April, and then we're gonna try again to send in our request for May through December. And then Dr. Viana updated her medical report and how she presents it. There is a lot more charts. The information is more concise, and she did kind of a smaller verbal report, kind of just outlining the changes and going through the information. And, you know, flu cases are up, and she's tracking that and keeping up to date. And so the request from the Board of Health membership was to kind of have more of a verbal report from the doctor, kind of like Dr. A used to do, just not only for the Board of Health, but also for the public, especially now that Dr. Harvey is like kind of stepping off the Board of Health and losing that, that expertise. We did elections, so I'm the new Board of Health Chair, and then Perla Newton is the Vice Chair for the Board of Health, and so very excited about that. And so it was a short Board of Health meeting, but yeah, that was kind of the overall aspect of it. Oh, we did the opioid response plans. How could I forget?
Oh,
Oh,
yeah.
gosh.
Yeah, I was gonna say, I think we.
That was the most important piece, the opioid response plan. Katie went through the updates of it, and kind of what they're doing, the outreach that they're doing. They have, they're doing billboards as well as they had showings in the movie theater for PG-13 movies, and they had 408,000, like, so that was very good information. And of course, working with the opioid task force, and you know, just looking forward to 2026 and kind of that continued outreach and reducing the stigma and continuing to have those conversations was a big part of the plan. And of course, you know, Katie always does a fantastic job, so we approved the opioid response plan for 2026.
So I had Transportation Policy Board this morning, and, I mean, just a couple updates. Well, one thing was that Mayor Ryder's out sick, so that might be interesting this afternoon, and then, or today, but we talked, we're working on elections, and, we reappointed Renee, Sinclair Radcliffe to the community position. She is currently the vice chair, and I'm currently the second vice chair, and I think we all three are planning to be elected again or asked to be elected again. And he's the chair, and he's been the chair for forever. Yeah, and so, you know, and so that's what's going on there. But we talked about the Federal Transportation Reauthorization Act, and the initial draft's gonna be out soon. We talked through like the US DOT priorities, and then as a group, you know, we talked about next steps, and what they asked us to do was to go and ask you all, you know, what should we be focusing on and lobbying with our federal representatives? And so I just wanted to bring that to, you know, we did bring up some things, the Yelm Loop, Martin Way corridor. I mean, just wanted to bring some things that back to you guys to see if you had any input on that for our next meeting.
Federal transportation priorities.
Yeah, I didn't know, I mean, nothing jumped out at me when I was sitting there and I was like, well, I can go through the R-tip and look really quick and, but, you know, is there anything that, you know, when we're at NACO or anything like that, that, you know, and maybe that's the other thing I wanted to bring that up for, is that if there is a list of things that, that TPD comes up with, I don't know if we can bring that up to our representatives when we're back east, so.
Has, slightly off topic maybe, but like, you know, a couple of years ago, it was a lot of chatter and work around the Squally River and all of that. And I know it's a high price tag and the state probably doesn't have the resources, but are people talking about it still? Because that river is gonna continue to push toward
Set the stage.
you know, toward the I-5 there.
It has been a conversation, I think, with DOT. It's just choosing which plan is moving forward has been the struggle. DOT and the tribe have different thoughts. I think TRPC has different thoughts on which model to approach. I think DOT wants to go with kind of the cheapest base level model, while the tribe is saying, like, if we're gonna do this investment, it needs to be, and me personally, I tend to agree with the tribe. I mean, if we're going to go through that huge remodel, the opportunity to connect rail down, have all those different opportunities later on, I think is the way that we should be looking at this, instead of just replacing the bridge and you know, hoping the river. I agree with you, like during these floods, going over there and seeing how high the river was definitely concerning, and to me, it is a ticking time bomb, and I don't know. I think that should definitely, you know, be conversations that we're continuing to have, so just pushing for that at a regional level of like, this is still a priority, and so I agree with you on that, Commissioner Mansur, that's.
Yeah, and I just echo that. I mean, we've seen these, I mean, it's like pre-planning plans, you know, of, you know, 3 options or something like that. And, you know, one big discussion that we had at the Transportation Policy Board was around high-speed rail and, you know, and the connection, I mean, to be thinking about Sound Transit and what that looks like, you know, that's a long ways away. You know, but I think part of the planning of them choosing a plan will be that train track, and whether or not, you know, we're going up, above, over, under, and what we're doing to, you know, reassure that train area. So, I mean, I don't know if we can set the stage for that or just be saying they should be paying attention to it. And then, I mean, there were a couple other things just, you know, came from our community representatives. They really hope we are focusing on pedestrian safety initiatives. I mean, some of the smaller things, some concerns about the number of pedestrians in Thurston County that have had accidents this last year has been much higher. And so, but other than that, I was just hoping maybe you guys had some bright ideas.
Well, I'll send them your way if I think of it.
Okay.
So it was something that was brought up at TRPC as well, and I think the response from the membership there was also the same, of like, let us think about it. And I know our county engineer was going to like list up some of the projects that Public Works is working on too.
Yeah, maybe we could have them do that, yeah.
And seeing, you know, kind of what fit for our county priorities. But I think as we're talking about regional, thinking about the Nisqually Bridge. I don't know with the Martin Way corridor, it's a conversation that we brought up to the different jurisdictions to go in it together, and it kind of always ends up falling apart. And this year when our staff approached, I believe the county manager said our staff approached the rest of the jurisdictions about it. They kind of, it wasn't on the top of their list for projects, and so.
For federal priorities.
For federal priorities, Okay.
And so that was kind of like why we ended up writing it off our own list. So I'm not sure with that one if it's still going to be there or how.
Okay.
Yeah.
I mean, I don't, there's always a lot of projects, but I don't feel like there's one burning fire that, like the Yelm
Well,
stuff.
the Yelm Loop is
Right.
definitely.
That's the biggest thing because it has like
And SRL 507's new roundabout.
it has the additional component of resilience for, disasters or,
And the annexing and the growth and the transportation problems.
yeah,
in
so
Yelm,
to me, that's still kind of probably is a little bit above the general.
Well, I'm happy to make that a priority.
Yeah.
I mean.
Yeah, I know you'll get that
yeah,
covered.
Yeah, we definitely do that.
I know a lot of people have their eyes on that.
And, okay, and that brings me to the last thing is I'll tell you that last night they approved the ILA for the annexing at the city council meeting.
They did, okay.
Many of the same people who attended our meeting from George Road were present and gave testimony.
Was it unanimous decision? Or?
It was a unanimous decision to move forward on the ILA, and then in 2 weeks they'll be voting on the annexing. So, just just letting you guys know.
That's good to know.
You can let the auditor know.
Yeah.
Auditor's precinct team. Okay, that's good info. I don't know that I have any committee reports. I don't have my list, but of what I've done, but nothing sticking out. While you guys were Board of Health, it's not a committee, but I was able to go to the River Ridge ribbon cutting for the all the new library is absolutely beautiful.
Nice.
And the North Thurston School District was having a council meeting there with student performances, and yeah, it's pretty amazing. If you haven't seen that, that was fall from their last bond. To see what they were able to accomplish with that was pretty. The library is beautiful.
That's great.
I'll give a couple more updates if that's okay, Chair.
Absolutely.
So just as a FYI, I testified on two bills this week. House Bill 1982, which is to vacate basically charges for individuals during fish wars, and expanded it to include pasture and all the different items. So testified on that. That was something that the county had marked as supporting in the past, and so I testified for the county on that. One that I testified as an individual commissioner, but still letting you all know or I didn't get a chance to testify, I didn't get called on, and because I signed up as an individual and not with my title, is SB 5855, but I did send in written comment, and so I just want to let you all know, and that's about the law enforcement masking bill from Senator Valdez, and Senator Bateman has signed as a co-sponsor on as well, but wanted to let you all know that I did sign up. And for that legislative steering committee, we had, I think Commissioner Fournier mentioned it. It was a half-day meeting. We were reviewing just our policy framework, how we're going to address. We reviewed. We didn't go into the bill review that we usually do. This was more focused on like higher item policy items, reports that are coming down that the legislator has, ordered in the past to work on, and staff have been working on, and had the membership vote on them, whether, they wanted staff to continue to work on them. I can give a more detailed list if the board is interested on it, because there were quite a few of them. And then for the National Association of Counties Justice and Public Safety Steering Committee, there was basically a immigration policy framework that I had mentioned to the board that I've been working on and sending in comments, and that meeting was kind of the day before that, and so there was a lot of conversation from several counties where they are, the state has different regulations than Washington, of course, so it doesn't really apply to us, but where counties are forced to cooperate with immigration, and the reimbursement
of that and how much it's costing counties, and they're not getting reimbursed and they're not. And so that was just a big topic of conversation. A lot of the counties felt that, the state kind of forced them into this position to kind of sign this cooperation, and yet, some of them were not. It was just a very interesting conversation about the Act 287. And so, and then the National Association of Hispanic County Officials, Congresswoman Emily Randall came in and presented on the bill that she is sponsoring in Congress in terms of the Emergency Responder Protection Act, I believe it's called. And so she presented to that, and then we had a conversation afterwards. Commissioner Fournier came in and kind of talked about kind of as a first responder, kind of how he drafted this and what we're doing here locally and what is going on at the state level. I believe Representative Parsley is sponsoring a bill for that. And so one of the pieces that we're going to do is we're going to be drafting something for the National Association of Counties. We might be passing it through the Health Committee, so I might be reaching out to you for your support and sponsorship on that one, or we might be passing it through the Justice and Public Safety Steering Committee. So to have that as a priority for the National Association of Counties. So that's kind of overall.
Were you hearing any, on that masking bill, were you hearing like a broader range of public comment about it?
It was very limited. It was the last bill, and then they added a bill on top of it, and they had to hard stop at 10:30 because they had the governor coming in and speaking. So it was very limited.
I was just curious if people were speaking in favor of law enforcement being masked, what were they saying is the reason? Like, I don't understand.
Doxing and their lives being threatened and being followed home.
Which can happen to anyone in any government role.
Okay.
Other committee reports? All right, sorry, good. See everybody in the chamber probably.
Yeah.
All right, adjourned.